Welcome back to Living East Tennessee. Well, according to the CDC, around 900,000 Americans are affected by a blood clot in their veins every year, and usually it's in their legs. Now, blood clots are dangerous because they can restrict the flow of blood to your entire body and turn deadly without any warning. Now, Vascular Surgeon Dr. Gusev joins me with Premier Vascular Center here in Knoxville, and he shares what he wants people to know about the symptoms of blood clots in their legs and how to eliminate that danger. Welcome to the show, Doctor.
Well, thank you. Good morning. Thank you for having me.
Absolutely. Good morning to you as well. Now, I would love to know more about who is at risk for developing these blood clots.
Yeah, there is a pretty well studied body of evidence that says that people who are immobilized for some period of time, you get sick and you're spending a long time in bed, you're at risk. Trauma, if you are taking some kind of hormone replacement therapy or oral contraceptives, that puts women at risk. Also, if you have some kind of malignancy, that causes your blood to shift into this propensity of making blood clots. Smokers as well.
Absolutely. Now, what are some of those symptoms?
If you develop blood clot in your veins, in your legs, your leg may swell up, it get painful, it can change colors, and if the blood clot goes to the lungs, that you may develop shortness of breath and your heart may start racing.
Absolutely. Now, what are some of those signs that it's a very dangerous blood clot and maybe you should seek immediate attention?
So yes, so when you do have massive swelling of your leg and you're starting to lose sensation or the color changes different, your leg becomes super pale compared to the other one, or it's blue, and the signs that are even more urgent when you have shortness of breath or your heart is starting to race, then somebody needs to check you out, make sure that that clot that formed in the leg did not go to your lungs.
Interesting. Now, I know that they can often be treated with medication, but what are some of the long-term consequences of blood clots in the leg particularly?
Yeah, so people think that once you're put on the blood thinner, which is the standard of care, and it's very effective and minimizes those dangerous risks of having a blood clot that causes you to die, they actually are not dissolving all the blood clot in your legs, so it changes its form, but it becomes scarred in, and you can have leg swelling and pain for years after this event.
Yeah, absolutely. Now, what are some of the options for removing blood clots, especially the ones that go kind of deeper?
Yeah, so those big blood clots in your legs that are in your deep veins, within 2 weeks, while the blood clot has not changed its consistency, we can suck it out with special devices or put it in a cage and pull it out.
That is so interesting. And I mean, that's a newer technology. How does that make it so much better for the patient as well?
Well, definitely, now you don't need to cut the patient. You just poke into the vein and put that big sort of a vacuum cleaner hose in there, and then you suck out the blood clot. I think you guys should have this on the screen there for your audience.
On the screen.
That's right.
That is so interesting. I love learning about new capabilities like this that make it so much easier for patients. Now, if you do have a blood clot removed, can you come back, or do new ones form?
Yeah, if the underlying risk has not been mitigated, you're continuing to smoke, your hormone therapy has not been appropriately managed, or you do have a malignancy, you need to stay on the blood thinners, and basically just talking to your doctor, your primary doctor or hematologist, and getting that direction, and really not skipping out on blood thinners because it can't come back.
Absolutely. So for anyone watching that thinks maybe something I need to get checked out, where can they go to learn more information about you all?
Well, they can go to premiersurgical.com, find us, and they can come and visit us, especially if they have a blood clot. We're always open for consultation, and we can definitely help you out, either surgically or just making sure that you're seeing the right people and on the right medication.
Absolutely. Well, thank you so much for sharing all of this information. I know it helps so many people out there, and we will see you guys next time.
My pleasure. Thank you so much. Appreciate you.
Absolutely.